gracious, the most merciful. All praise is for Allah, the Lord of the worlds, the most gracious, the most merciful, the master of the day of judgment. You alone we worship, and you alone we ask for help. Show us the straight path, the path of those upon whom you have bestowed favor, not of those who incurred your anger, nor of those who have gone astray. Jazakallah. The voice
इस
of
बार
God.
आप इनको इनवाइट कर लें, वो जो आ गए हैं डॉक्टर, उनको पहले सर का मैसेज आ रहा है.
Okay. The words of Holy Quran. وَمَا أَرْسَلْنَاكَ إِلَّا رَحْمَةً لِلْعَالَمِينَ. Translation of this verse is, and we have not sent you, O Muhammad, except as a mercy to the worlds. Now I would like to invite our respected guest speaker, Dr. Enamuel of Department of Medical Laboratory Science, Kampala International University, Uganda. Thank you so much, sir, for joining us, for your precious time you have given us. Please start and share your precious knowledge about use of umbilical cord blood in the management of leukemia. Please, sir. Sir, please turn off your mic. I request you your mic, please, sir.
Hello, greetings everybody. Greetings professors there, the researchers there, the university management teams, the vice chancellors, the organizers of this program, scholars from all over the continents of the world. I want to welcome you to this important webinar. And I will be talking on the topic, the title, the use of cord blood in the management of leukemia. Leukemia is one of the life-threatening, hello? I hope you can hear me.
Yes, sir,
Hello?
please.
Yeah, okay.
Yes.
Leukemia is one of the life-threatening blood cancers. And I'm sure you people will bear me witness that one of the major causes of death today in the whole world, both in the developing and then developed countries, are cancers, particularly the blood cancer. And whenever disease occurs in the blood, it's not always easy to manage or to control or to treat. A lot of people have lost their beloved ones as a result of blood cancer. And then the researchers are not left out in the menace, in the trouble, in the dangers associated with the leukemia. A lot of people, a lot of researchers and scholars who are involved and grafted in research in the laboratories inhale a lot of heavy metals. And as a result of the inhalation of the heavy metals, it will get lodged in the blood, in the bone marrow. And then it will infiltrate in the bone marrow, causing a release of immature cells. And in that case, it could translate into maybe an acute leukemia or chronic leukemia, depending on the stage. A lot of management methods and treatment protocols have been tried in the past just to see that lives are saved. Health workers, clinicians, scientists, and the nurses and everyone that are involved in the management of patients, their target is to save life. And this topic is very important to everybody so that lives of so many persons will be saved, as a lot of people have been embarking on research to stop or curb the menace of leukemia. A lot of professors have died as a result of hematological malignancies. And then I want to tell you that with cord blood, how do you harvest it? How do you get it? It is very simple. A lot of people are wasting cord blood. A lot of women, when they give birth, and then the hospital management, the nurses, the midwives, the gynecologists, because they don't understand the importance of that God-given natural way of curbing a lot of malignancies, they will discard it. And I want to tell you that it is a precious gift from God to save man. Last week, I lost someone as a result of cancer. Last year, I lost someone as a result of cancer. And then what do? So I want to tell you that umbilical cord blood is very important in saving lives, particularly for leukemia, both acute leukemia and chronic leukemia. It can help to save children. It can help to save adults. And nobody is left behind when it comes to blood cancer or even cancer generally. So how do you get it? The cord blood is gotten after delivery from the umbilical cord, the blood there, and then the placenta blood. And that is what we call the unit, the blood cord unit, 1 unit. Depending on the gravity, on the severity of the disease. If it's a little child you want to transplant with cord blood, you can use 1 unit. But if it's an adult, if the condition is severe, you can use up to 2 units. And it has, some researches have proved that it is better than using bone marrow transplant or peripheral stem cells, because the cord blood is rich with stem cell, hematopoietic stem cell, HCS. You know, there are 3 places you can get hematopoietic stem cells, which has a capacity to proliferate and multiply, and that is why blood is always maintained in individual. But other ones involve an invasive method, both the peripheral stem cells and the bone marrow stem cells. And then those ones has a serious challenge that before you get patients, donors that can match the patient due to HLA incompatibility, and that could lead to for somebody to look for a match donor between 3 to 4 months. But with cord blood, due to that immunity, the immune level of the neonates is not well developed, so it can graft disease could be reduced. But if you use bone marrow transplant stem cell and then that of peripheral stem cell, the level of graft versus host disease will be very high. In that case, rejection, and then even the life expectancy of the person that the recipient may be affected. And then because in the cord blood it has CD34 plus cell, which help in the immunity and then immune reconstitution that help the recipient to even to recover fast, unlike other transplant. So there are a lot of advantages. It has been used to cure even some immune deficiency conditions, some metabolic disorders, a lot of leukemic conditions, both acute myelogenous leukemia and the rest of them. So I urge you people to try in different countries with your national regulatory bodies to have public cord blood transport blood banks where people the blood of this that is collected after delivery will be stored. In fact, research has proven that even after 20 years, the stem cell gotten from cord blood can as well save life and is always effective. The advantage, the benefit of using cord blood are immeasurable. It's just that so many persons don't know the impact, the benefit it can give to save a lot of lives. A lot of death that many people undergo is as a result of malignancies that are hematological in nature. And then people will be doing other diagnoses that is a misdiagnosed condition, and a lot of persons, both scholars who have spent so many years in reading and studying to save life, they have lost their life prematurely because of maybe the lack of knowledge of this. So I urge you and everyone that is listening to me in your country to liaise with your government, liaise with the hospital management, liaise with the owners of a university, and set up a research center for this area, because it's a burning area, is an area that is a clearing call to save lives. So I urge you and I advise you to key into the stem cell research, which cord blood is one of them, and it will save a lot of lives in the society. Thank you for listening. Hello? Hello? It's
Hello.
time to ask me questions. Yeah, I'm waiting for questions. Yeah. Yes? Any question? Please, the host. Okay, both you wanted to ask question. Please, you can unmute yourself and ask your question.
Hello? Yeah, okay.
Yes.
Hello, can you hear me?
Yeah,
You
I
can
can
hear
hear
me?
you.
Okay. Uh, good evening, presenter, Dr. Enamuel. Good evening, distinguished colleagues and participants worldwide.
Respected sir,
This is
I
a
hope
rare
you have
privilege to
completed your
be
lecture.
part of this presentation, but I think stem cell research is a novel area in the medical sciences, and especially for us here in the developing countries. However, I want to commend you for your presentation, and then want to add that in a webinar like this,
Respected
would have
sir,
expected to see some
Dr.
scientific
Enamuel. Sir, have you
evidences or backup
completed your
or
lecture?
to show a
Please give your
data
response.
of this progress in this area, especially the usage of umbilical cord for blood for management of leukemia. However,